I treated somebody for labyrinthitis, and she will tell anybody who wants to listen that I saved her life. I don't think I did, but she's utterly convinced I did because she was suicidal. I didn't know that. I found out afterwards, but she was suicidal when she came to see me, and I really think all I did was tell her she'd be all right, and gave her hope. And because and she didn't have any hope. I might have been completely wrong to tell her she was going to be okay. I don't know. But I told her she'd be all right, and I think that then allowed her to heal naturally, which she might have done otherwise, perhaps over a longer time scale. Anyway, her best friend phoned to say, would I recommend a cognitive behavioural therapist for her husband? Because her husband was depressed and he just had a big row with their son, become violent, and she thought he was going to have a nervous breakdown, and did I know a good cognitive behavioural therapist that he could go and see? And I said, well, I can't really send him to a cognitive behavioural therapist because I don't know that that's what he needs necessarily. I'm happy to see him and assess him and tell him and or you what I think and not treat him. She said, no, you can't hypnotise him, his mind's not strong enough, he couldn't cope with any of that. I said, well, if you'll have to pay a session fee, but if you want to, I'll assess him. So that's what we agreed to do, and he came along in all sorts of a state, apart from being depressed, and he'd been medicated for depression since he was 19 years old, and he was now 69. So he'd had 50 years worth of antidepressant medication. When I sent out the appointment confirmation, I'd had to take every mention of hypnosis out of my standard letter. And it was just about assessment. Anyway, fairly early on in the assessment, I said, look, I'm a hypnotherapist, I'm a clinical hypnotist, I'm not going to hypnotise you. That's not what you're here for, but I don't want to hide anything from you. We're going to assess what you need. Why does your wife think you're about to have a nervous breakdown? And he said, well, I think she's probably right. I spent all my time and all my energy trying to stop myself going over the edge. I've been on the edge for I don't know how long now, and trying to stop myself going is just exhausting. I don't think I can hold on for very much longer. I'm going to go soon. It also turned out that he'd had kidney, liver, some problem with one of his organs, I'll remember the name a little bit, which was causing him great pain, and he'd been on these slow relief pain patches for 22 years and was still in pain. There were other issues as well. And the guy was just a mess, a real mess, with a very, very full case history. And I'd started seeing him at 2 o'clock. I had somebody else coming at 4 o'clock. Got at 3:30, when usually I'd be saying, right, off you go. Instead of which I said, I feel really bad about you going away from here without me at least trying to help you. And just, assessing. So would you mind very much if I tried hypnotising you? And he was nervous and anxious. Pancreatitis. That was it, pancreatitis pain. 22 years of it. So anyway, we had a brief talk. He agreed to let me hypnotise him. So I put him on the couch, hypnotised him, took hold of his hand, literally, physically, held his hand and said, I'm going to walk you 30 metres away from the edge. And you're not going back there. 1, 2, I walked him 30 metres away from the edge. That was all I did. About 6 weeks later, he was off his antidepressant medication. But in the meantime, he'd asked me if I could do anything about this pancreatitis pain. And he'd read on my website about trepanolol. And he knew it was a Thomas the Tank Engine egg cut, Sainsbury's antibacterial gel, the Johnson's cotton swab, and an electrical screwdriver. Not only did he know all of these things, but he's a chemist. An Oxbridge degree in chemistry, industrial chemist for all his working life, who then taught A-level chemistry at an independent girls' school. This guy is a chemist. He knows that trepanolol is a figment of my imagination. So I gave him 10 mil. 10 mil of trepanolol in his shoulder. I don't like shoulder, but I did. Through his clothing. How ridiculous can you go? You know what I say about enter the patient's map of the world? Sometimes I think you have to go completely the other way and get so far out of their map of the world, otherwise they just pick it apart. They understand their map of the world, you have to take them somewhere else sometimes. Anyway, in a way that's what I was doing with him. I gave him 10 mil of trepanolol on his shoulder and off he went. He came back a week later, he'd been pain-free for a week. His subconscious, without me saying anything, had built a reservoir. It had built a reservoir in his brain that it had put this trepanolol in, and it had become self-perpetuating, and he could call on it whenever he wanted to. And I hadn't said any of that at all. And he was, so within 8 weeks of him coming to see me first of all, he was off of all of his medication. Pain relief, he'd had the slow release patches off, had no medication at all anymore. Under his doctor's supervision, that is, not with him deciding that he was, I said, go back and see your doctor. The doctor phoned up and said, what have you done to this guy? It's good hypnotique.